officially start the 4th annual meeting of the Interdisciplinary Nursing Quality Research Initiative. My name is Lori Melichar. I'm a Senior Program Officer here at the Foundation, which means I get to welcome you all to my home in Princeton and tell you why we're so excited that all of you are here. One of the core goals of the Foundation is to improve the quality of care delivered in the United States in a range of healthcare settings, and we believe that in many settings, nurses hold the key to delivering superior healthcare outcomes. We all hope that when it comes time for members of our family to enter the hospital or other healthcare setting, a nurse will be there to manage their care. But as many of you know, research has shown that most nurses are overworked, undermotivated, underused, and practice in environments that too often set them up for failure. This means that instead of spending time with patients at the bedside, managing their pain, and coordinating their care, nurses are too often interrupted and pulled away for housekeeping tasks, paperwork, or to hunt for and gather supplies. Instead of being rewarded for their role in intercepting medication errors and involving patients in their own care, nurses find themselves excluded from discussions about quality improvement and find their budgets the first to be cut. Instead of leading quality improvement initiatives and health reform task forces, opportunities to learn from the professionals best able to anticipate the impact of proposed changes are being missed, as nurses are left out of too many discussions around board tables and on Capitol Hill. It's as though healthcare administrators and policymakers just don't understand the values nurses contribute. Well, not for long. We're now in year 3 of this initiative, and since we don't give any no-cost extensions, that means that the first cohort of INQRI grantees has already produced results that capture how much nurses now contribute to the quality of care and how much more they could contribute. INQRI researchers in our second cohort will soon be presenting findings that show that what nurses do is critical to keeping patients safe and improving their health. You'll see 2 panels of researchers from INQRI's third cohort. These teams are in the middle of their grants and could benefit from your guidance as they strive to ensure that their end results will have the maximum impact on policy and practice. Finally, you'll be hearing from our newly selected teams. Work to be done by these teams will look at improving patient communication, reducing pressure ulcers, improving pain self-management, reducing the risk of type 2 diabetes, and evaluating nursing's contribution to palliative care. I think you'll find their proposals fascinating, and they'll benefit from hearing feedback as they present their project plans. With each of the up to now 39 INQRI projects so far, we hope to show all decision makers with the power to allocate resources to nurses that hospitals and healthcare settings where nurses are valued, where they have a say in quality improvement, and where they are supported in their efforts to keep patients safe and healthy, or where patients want to receive care. Now, these are grand claims and aspirations for a research program to be making, but I think by the end of these 2 days, you'll all agree that INQRI is not your average research program. INQRI grantees are not funded to do research for research's sake. You are all here to make an impact on the quality of care provided in the United States. Over the next 2 days, and for some of you over the next 2 years, you'll learn more about the why and how of INQRI's mission. As Mary will explain, this annual meeting is a key component of our work around a common goal of producing evidence that will be used to improve the quality of care provided by nurses in hospitals and other settings. I want to welcome many of you in the audience who are and represent the decision makers. I want to welcome our advisors whose input and feedback are so important to accomplishing our goal of impact. And I want to welcome members of INQRI's cohorts 2 and 3 who will be presenting their preliminary and final findings today. And I especially want to welcome and congratulate our 5 finalists, interdisciplinary research teams examining the link between nursing and quality. And we're going to meet you all later, but I'd love to have you all stand up so that everyone can look around and we can officially congratulate you before we put you to work.